We are going to cover PowerPoint number 8. We are in Chapter 6 of your Essentials of Health Information Management textbook. So we're going to review today patient record documentation guidelines. Now this can be inpatient, outpatient, and physician office. So we're going to go through each of those different documentation requirements. So let's go ahead and we're going to move to the different forms that you're going to find. Again, these are going to be inpatient. A couple of different things to remember: just because they're inpatient, a lot of times they will take those records and send them to the patient's physician office chart. That way the physician office has access to everything that happened to the patient as an inpatient. So again, this could be also an outpatient procedure. So remember, any anesthesia records, these could be an outpatient too. So let's start off with a patient receives an anesthetic other than local. Okay, so we're talking general anesthetic. The anesthetic record, pre and post anesthesia, progress notes, recovery room record, it's going to provide complete documentation of the administration of preoperative medications. Let's go ahead and talk about the contents of what is all involved in an anesthesia record. Okay, so everything for pre-anesthesia, this needs to be, again, documented. We need to know the type of medication that was administered, including the time it was given to the patient, how much, so the dosage, and the effect on the patient. Appraisal of any changes in the patient's condition. You know, are they lethargic? Are they awake? How did they react to that anesthesia? So your anesthesia agent then is administered. Again, we need to know how much, the technique, the effect, and the duration. Keep in mind with the duration is how long were they in surgery. So pre, it's going to be before. Post, maybe a little bit longer. They start waking the patients up. So with that, you're looking at the patient's vitals. Was there any blood loss? Okay, usually in any major surgery that a patient has and they make an incision into the body, you're going to have blood loss. So they want you to make sure that this is documented. And transfusions. Did they have any blood transfusions? And what type of IV fluids were given? Standards. Medicare requires documentation of pre-anesthesia evaluation note on the record within 48 hours prior to surgery. Same thing with post-anesthesia. This note needs to also be on the chart 48 hours after surgery. Again, you want these on there in a timely manner because if you need to, or the doctor or anybody needs to look at information on the anesthesia, they need to be able to have access to it. Okay, so let's talk about our operative record. Okay, when we talk about operative record, you're going to look at gross findings. And when I say gross, I mean you can see it with the naked eye. You can look at it and evaluate it. Again, what organs did they examine? What were the techniques associated with the performance of surgery? One thing I'm saying here is, was it arthroscopic? Did they open the patient up? Okay, those are different things that have to be in the operative record. Also, one thing, it has to be dictated or handwritten immediately following the operation, and then the surgeon needs to authenticate it, sign it right away too, because they don't want to forget what happened. So again, this is a standard that needs to be done promptly. Okay, what all needs to be included in a operative report? We need to have the principal participants, the surgeon, was there an assistant surgeon, the pre and post-operative diagnosis. One thing to remember with these, they can be different. Okay, again, the patient may go in there with a preoperative, but once they did the surgery, they found out that their pre-diagnosis is no longer valid. That's not what, is wrong with the patient. Surgical procedure performed, and then the anesthesia administered, the indications for surgery, and what is the condition of the patient? So again, documentation here. We have a detailed description of the operative procedure performed, and there should be a description of operative findings. Again, what unique thing happened during that surgery that possibly didn't happen at a different surgery? And then date and time of surgery. So standards, the Joint Commission does require the surgeon to document anything following prior to performing the surgery. So there should be a history and physical examination. Lab work needs to be done. Usually x-ray, like a chest x-ray, is always pre-op. And then all diagnostic and therapeutic procedures are to be documented in the patient record. And the report then at that point is filed in the chart immediately after surgery. Okay, so the outpatient prospective payment system, major and minor procedures. Okay, so let's talk about a minor procedure. This is usually performed in less than 5 minutes. Okay, so that's probably going to be, again, outpatient. Major procedures are usually performed in 5 minutes or more. Okay, major procedures can be, again, outpatient too. So a cataract surgery is considered outpatient. Okay, and that's a major procedure. Endoscopies are classified as a distinct group regardless of duration. So we're talking like arthroscopic knee surgery or arthroscopic bladder or gallbladder removal. Okay, those would be examples of that. A couple of different things with minor procedures. Keep in mind we talk, anything that doesn't stitching up. Okay, so major procedures are probably going to make some type of incision. The pathology report. The pathology or tissue report assists in the diagnosis and treatment of patients by documenting the analysis of tissue removed surgically or diagnostically. Example, that would be a biopsy or any expelled by the patient, products of conception. So anything they surgically remove from the body is sent to pathology. Good example, let's say somebody had a lumpectomy done for the breast. Okay, that is sent to the pathology department. And at that point, they look at it, whether it's going to be cancer, non-cancer, or what type, that's what they look at. So the pathologist performs first a macroscopic. Again, when I talk macroscopic, that's gross. Gross means, again, what you're looking at with the naked eye. Where microscopic is examination of tissues and documents a report. The pathology report is filed in the patient record as soon as it's completed, and this is usually within 24 hours of getting it back. So what's all in a pathology report? Okay, we have the date of exam, clinical diagnosis, what tissue was examined. Was it a lump from the breast, or did they remove the gallbladder? That would be sent to, again, pathology. Pathologic diagnosis. Okay, you're going to have a gross examination, which again, naked eye, microscopic is put under a microscope, and then your pathologist needs to, again, sign it. The standards, again, it is to be authenticated by the pathologist, not the nurse, not somebody working in lab, but the pathologist. The original is to be filed in the patient's record, and then there's going to be a copy of that in the pathology department. So they keep their own records too. Your recovery room record. Okay, so with that, after the surgery is completed, patients are taken to their recovery room. And at this point, the anesthesiologist, we have a recovery room nurse, they need to document, again, all the care that was given to the patient from the time that patient arrived until they get moved to the nursing unit. So what all needs to be happening here? What was the condition upon arrival? Was there post-op, post-anesthesia care given? The patient's level of consciousness upon entering and leaving the recovery room? And was there any complications that happened? And then along with that, we need vital signs. So again, temperature, blood pressure, all of that has to be documented. Standards. The Joint Commission requires a post-operative status has to be evaluated upon admission and then discharged from the post-anesthesia recovery room. There needs to be a record of vital signs. There needs to be, again, the level of consciousness of the patient. IV fluids and any drugs administered. This all needs to be documented, dated, and signed. Okay, so let's talk about ancillary reports. Different ancillary reports, they're documented by laboratory, okay? Chemistry. So this is any blood, urine. So anything, again, like that goes to the lab department. Radiology, this is all x-rays. It can be other things too. We get into nuclear medicine, which is stress test. You know, we have MRIs, we have CAT scans, all that goes into these areas. The responsible physician with this must document requests for ancillary testing to be performed in the physician's orders, and then the patient record must include documentation of the results of that chest x-ray or the results of, let's say they just had a regular, pregnancy test, urine test would be lab. And then the treatment plan, what are they going to do with these results? Do they need to treat the patient differently? Standards. All ancillary reports should be filed in the patient record as soon as the interpretation has been made. So as soon as they interpret the results, the doctor, again, this should be done within 24 hours. These reports have to be signed by the person performing the test. So if you have a radiologist, so again, by the person, not necessarily it's going to be a doctor, but, it's going to be by who is performing the test. The original, once again, is going to go in the health record, and then a copy is always going to go in the ancillary department. So once again, the lab department is going to have all those lab documents there. Same thing with radiology. And there is lots of different reports. So make sure you review your textbook for the different reports. And this, again, is in Chapter 6. Okay, so let's get into nursing documentation. This is a crucial role in patient care because the majority of care delivered to inpatients is performed by nursing staff. Again, this could be a registered nurse, an LPN, and a certified nurse's aide. Any documentation done needs to be in the record. So the Joint Commission, once again, they state that nursing documentation must include the following. The initial assessment when that patient comes in. They have to reassess that patient. And what's the nursing diagnosis? What is the patient care needs? So we're talking, are they in a special diet? Do they have to have their blood pressure taken because they have high blood pressure? So does the blood pressure need to be taken every half hour, every hour? Again, different things the patient needs for the nursing care needs, nursing care provided, the patient's response to, and the outcomes of care provided. Types of nursing documentation. Okay, we have the nursing care plan. Again, this can be very lengthy. Nursing notes. Anytime they go in there to see the patient, and you will see that they go in there and will go down to bedside terminal system, which again, this is also called point of care. So you go in, see the patient, the nurse does, and right away they're typing on the computer. They're documenting those notes right away. We have a discharge summary. And then if you look in a chart, you're going to also see a graphic sheet, which is going to just be a sheet that is recording the temperature, pulse, and respiration. This sheet, a lot of times you'll see it as TPR. Okay, so again, if they document these things here every hour, maybe twice a day, 3 times a day, it just depends again on the patient's condition. Let's talk about special reports next. Okay, so we're getting into the obstetrical record. Again, is the mother's record. This contains the antepartum, labor and delivery, and postpartum. Let's start off with the antepartum. Everybody knows